a cancer survivor? It can be someone riding the tidal wave, someone who's beat cancer, or someone in remission. One definition of survivor is a person who remains alive and continues to function during and after serious or life-threatening illness. Often people are only considered a survivor if they've been cancer-free for 5 years. True survival is living as best as one can for as long as one can. My survival started the day I was told I had leukemia. That day, I made the affirmation to fight and go where the detour would lead me. I like to say, I'm not just surviving, I'm thriving. I've made the choice to live like every day matters. In the early day of my illness, survival simply meant carrying on with daily life. I worked for 6 months before my blood counts were at a level that treatment could start. I only shared my diagnosis with a few people because I didn't want anyone to treat me differently. The constant wondering about when I'd have to start treatment was a very difficult time. Even though I was a nurse, I knew absolutely nothing about leukemia. I made a promise to my physician not to research my disease or find out what the life expectancy for my type of leukemia was. To this day, I still don't know what my life expectancy is, but then, who really does? Survival meant having the mental energy to sort out all the financial issues that come along with being a cancer patient. It was a challenge to sort out the pile of information that came regarding applying for disability benefits from work, as well as applying for Social Security disability. Being in the hospital for 28 days for induction, transplant, and recovery was an exercise in not just physical survival, but mental, emotional, and spiritual survival as well. It was a huge help being able to talk to a fellow transplant recipient who was further along in the process than I was. Every night I would walk to the one little window from which the sunset could be seen. I felt empowered to make do not disturb signs from my door to use when I felt the need to recharge. Having volunteer Reiki practitioners work on me a few times a week did a lot to help clear my mind and relax me. As I was being discharged from the hospital after my stem cell transplant, I remember the doors of the oncology unit closing behind me. I was heading out into the great unknown called my future. I felt like my security blanket had been taken away. In the hospital, I had people reminding me to wear a mask, do strict mouth care, and to eat well and rest. My cup of medications would magically appear at the appointed time. The outside world where I'd have to do all those things myself seemed overwhelming. Sure, I was given a giant binder full of information and resources. I was barely able to concentrate long enough to read the comics, much less digest information regarding what side effects to expect months and years down the road. It was overwhelming to have to make decisions and fill out forms for disability and Social Security. I have a new appreciation for the case managers and patient navigators who helped me wade through the murky waters. Chemotherapy and radiation affect every body system. My vision changed. When one of the nurses saw me attempting to put in my contact lenses, I got a lecture about the risk of eye infections because of low immunity, something I never would have thought of. I lost some hearing and get annual hearing screenings. Pulmonary function tests are done annually. On my 1-year anniversary, I had a cardiac echo to document baseline function. That will be monitored periodically. Did you know that massive transfusions cause an iron buildup in your bloodstream that can cause liver damage? I certainly didn't. My ferritin level was 4 times the normal level. For months, I took a medication to decrease it, but I had to stop it because of the side effects. It's been 1 year since my last transfusion, and my ferritin level is just about twice what it should be. In order to have good oxygenation, one must have enough circulating red cells. For the longest time, my hemoglobin remained low. I could tell when it was low because I couldn't go to a higher elevation or do a lot of physical activity. I now understand why blood doping is so effective for athletes. While it's still not textbook normal, my body has adjusted and is happy where it is. I developed a condition where I make plenty of platelets, but my body destroys them. Again, while not anywhere near what would be considered normal, my body has adjusted. I was told that my white cell count had to be 2 before I could be discharged. If I'd waited for that moment, I'd still be in the hospital. I'm hypervigilant about any sign of infection. Good oral hygiene is very important. I have to be careful not to expose myself to the sun for long periods of time without protection. Bone density is checked annually. I hiked 3 times a week before each chemo treatment prior to my transplant. The mental and physical benefits from that activity helped me through the 28 days I was in the hospital. I've slowly built my stamina up and now hike regularly. I'm very thankful that I never experienced graft versus host issues. As I get further out from my transplant, that risk decreases, but it still happens. Those early days of daily visits to the cancer center became my full-time job. I couldn't concentrate enough to read very much, but kept my mind active doing word puzzles. Filling out my weekly pill boxes was a mental challenge. While I was in the hospital, I acquired an infection in my Hickman catheter. As a result, I had a PICC line for 5 months. Being bald may have been a badge of courage, but to me, the PICC line symbolized that I was still sick. There were days when I would feel overwhelmed and not have any sense of what direction my life was headed in. When you're home alone all day, you have a lot of time to think. This is the time when it's very important to have a strong support system in place. In talking to transplant patients, I often find that they have come from other cities and don't have anyone close to help them other than the one caregiver that is required to be there. I also find that the caregiver is exhausted for the exact same reasons. It's very important to provide support for the caregiver as well. As time went on, I continued to try to define what my new normal would be. 6 months after my transplant, I got to go to Oklahoma for my son's graduation from basic training. I felt like I was on vacation of a lifetime. I was doing what normal people do. And 1 year after my diagnosis, I was given clearance to return to work, as long as I didn't have direct patient contact. The bedside nurse in me really struggled with that, but I was able to define nurse in a different way. As a trauma outreach coordinator, I transitioned from being an ER nurse to being in the community and teaching injury prevention. As anxious as I was to return to work, I had to wait until I'd been out a full year, or else I would have had to return all the Social Security income. You'd think the government would be glad that you were going back to work sooner than expected. On my 1-year transplant anniversary, I felt like I had conquered the world and wanted affirmation that I was alive and well. How did I celebrate? I went skydiving. Reaching out and touching the sky was an amazing moment, just probably not the smartest thing to do for someone without any platelets. From way up there in the sky, I could feel myself heading back to life's main road and knew that I wanted to spread the message that there is life after cancer. Giving back after a life-changing diagnosis is part of the survival process. It gives confirmation that life goes on and that as a survivor, you can help other people on their journey. Being able to mentor new patients that are bone marrow transplants is part of my giving back. Being on the other side of the hospital bed gave me a whole new perspective of what a patient goes through. Using my experience, I speak to nursing and medical students and bone marrow transplant patients. This gives the students a view they typically wouldn't get in school and shows BMT patients that there is light at the end of the tunnel. Soon, I'll be celebrating my 3rd anniversary as a thriving bone marrow transplant. Looking in the rearview mirror, I can see bits and pieces of the old me, gone but not forgotten. Looking forward, I don't take anything for granted. I look for the good in the simple things. I celebrate the small stuff and give thanks for all that I have. I am a survivor.